Skin. The skin is the largest organ in the human body and acts as a protective barrier against external influences. The skin consists of three main layers, each with an important role. The epidermis is the outermost layer of the skin, composed of constantly renewed keratinocytes or dead cells. It contains melanin, which gives the skin its color and protects it from ultraviolet rays. It has no blood vessels and instead obtains its nutrients from the layer beneath the dermis. The dermis is the middle and thickest layer and contains blood vessels, nerves, sweat glands, and sebaceous glands. It contains collagen and elastin, which give the skin strength and elasticity. It is responsible for sensation and touch and contains nerve endings. The subcutaneous tissue, or adipose layer, is a deeper layer composed of fatty tissue and loose connective tissue. Its function is to store energy, insulate the body thermally, and anchor the skin to the muscles and bones. Skin absorption, or transdermal absorption, occurs when substances such as medications or chemicals pass through the layers of the skin to reach the bloodstream. They pass through the epidermis, which is the primary barrier to absorption and consists of dead cells saturated with keratin bound to lipids. Therefore, lipid-soluble substances pass more easily. The other layer is the dermis. After crossing the epidermis, the substance reaches the dermis, where the blood vessels are located. Here, it is directly absorbed into the bloodstream. Diffusion then occurs throughout the body, entering the bloodstream via the capillaries located in the inner layer. However, there are factors that affect transdermal absorption, such as skin thickness, the role of skin structure, molecular size, the substance's solubility in lipids, and the duration of contact. What are the stages of hair formation? A hair is the growth product of the hair follicle located in the dermis and has three main stages. The anagen stage is the longest lived and lasts from 2 to 7 years.
In this phase, cells in the hair root actively divide, forming and continuously lengthening hair. This phase represents approximately 95% of the scalp hair. The catagen phase is transitional phase lasting from 2 to 3 weeks. The hair shaft shrinks, stops dividing, and detaches itself from the blood supply but remains within the skin. The resting phase lasts from 2 to 4 months. The hair is fully formed but doesn't die and eventually falls out. The anagen phase then begins. However, some stages of hair may die abnormally within the hair shaft due to weakening and abnormal growth. But what is laser hair removal? Laser hair removal relies on photothermal technology, meaning the laser device emits concentrated light that's primarily absorbed by the melanin. The pigment presents in the hair root within the follicle. This light is converted into heat, destroying the follicle without harming the surrounding skin. Thus, hair removal is accomplished using the laser. Laser hair treatment and removal may not be effective on blonde, white, or gray hair due to the absence of the melanin, and require several maintenance sessions after a period of time. It may cause a need to use the laser